everyone, this is Erika Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronnie Dean, and we are here at our Cardiovascular Institute, and today we have some special guests joining us.
We do, Erika. You know, it's always exciting when we have new physicians join our health system, and today we have some of the newest. Dr. David Hardy, fellowship-trained vascular surgeon, and Dr. James Shoptaw just joining us, fellowship-trained cardiothoracic surgeon. You know, Erika, we've grown quite a bit over the past year despite the pandemic. I believe we had 19 new physicians join us, and Dr. Hardy and Dr. Shoptaw are two of the next round that are coming. And everybody knows that the centerpiece of any health delivery system is the quality and capability of our physicians. And these specialists represent some of the finest, and we're so proud to have you all.
Yes, and Dr. Hardy, you joined us in January with vascular surgery. How are things going? What are you seeing? How do you like South Georgia?
I love South Georgia. So I grew up in Georgia, but I never really came this far south, and it's been really great. And not only me, my family's getting to like it. My kids are getting into the community. My wife's getting into the community, so it's great in that way. But the hospital's been pretty amazing. The people here, the support we have here, the staff, and when we say ancillary services, like as far as people taking blood and the nursing staff and the physical therapy and the food services, it's actually been really great for our patients.
Well, that's awesome to hear. I know you hit the ground running when you started, and we have had a lot of good comments and positive feedback from your patients already, so that's very exciting. We're glad to have you. And Dr. Shoptaw, you just joined this week, right? So how are things going for you?
I started April 30th, and I'm just now getting my feet wet, but it's been good. It's nice to be back in Georgia. I grew up in Georgia as well.
Well, that's outstanding. Again, Erika, it's really a delight for me to join a team that's growing with physicians like this. You know, I've been here 18 months now, and to have these physicians and others join us, really, the future of the health system is very bright. And I just want to tell both of you, we thank you for coming and being a part of our community. We've got great things planned for the people of South Georgia. These two men here are going to serve valuable resource for all of us as our health needs grow. And thank you all for being with us today. We really appreciate it.
Thanks for the opportunity.
Yes, and if anyone wants any more information about our Cardiovascular Institute, or if you want to learn more about Dr. Hardy or Dr. Shoptaw, you can visit our website at sgmc.org. Mr. Dean, it is so great to see this organization growing and welcoming such high caliber physicians to our team. But I do think we need to talk a little bit about COVID. What's going on in the system?
Well, we have to. I mean, honestly, everybody knows the number of hospitalizations across the nation are down. They're down in Georgia. COVID-19 hospitalizations are down. I think today we have 13 inpatients that are hospitalized with COVID-19. If y'all remember back in January of this year, we had upwards of 90 patients. We've accepted COVID-19 patients from 48 counties, I believe it is, across Georgia, Alabama, and Florida. And the fact of the matter is that although COVID-19 hospitalizations are down, COVID is still alive and well. But I'll say this, Erika, it appears as though we're sort of bending that curve. We've vaccinated over 31,000 through our vaccination line. We're testing less symptoms are coming through our testing center, not seeing as many through our ER that are having to be hospitalized. So it's a positive trend. Vaccinations are working, and then many others have received treatment for COVID. So I think overall, I'm not sure if we're achieving herd immunity, but we are seemingly not having the effect of COVID-19 on our community like we have in the past.
Yes, definitely a good sign to have vaccination numbers up. Testing demand is going down, and more sites are available throughout the community to receive these services.
That's
so
right.
How are we going to adjust our operations to kind of meet that demand and better serve our community?
Well, and one last comment about the types of hospitalizations. Now, I will say to the viewing public, And you know, we're observing the types of patients that are being hospitalized. And one trend we're not certain of, it seems that we do have a younger patient population that's among our hospitalized. As a matter of fact, the 35 to 55-year-old population seems to be a little higher percentage of our overall hospitalized patients. And I think other states, other communities have experienced that, but we don't know what that means. What we know is that we're still vulnerable to it. And we ask everyone to please take a chance on the vaccine if you feel like it. We really encourage vaccinations. We do believe it's our way out of this thing. And because more are getting vaccinated, it's probably helping us, you know, overcome COVID-19. Now, as far as testing and vaccination sites, our team has done a great job, just a wonderful job. First at Smith Northview, right in the heat of the battle, we put together the testing center, and thousands of cars have driven through the Smith Northview campus for testing. It's stay in your car, have the test, and the results come to you, and it's just really been great. But that testing demand has dropped way down below its peak. At one time, we were testing maybe 500 in a day, and now we're down less than 100, and in many days we're less than 50. So that's caused us to rethink, do we need to do something different? And then in vaccinations, the same thing. We were vaccinating through the vaccination line here at main campus, over 500 on some days, and that demand has dropped down to about 200, 250 per day, and it doesn't seem that the demand is there. We're going to continue to provide these services, but what we want the viewing public to know is we're going to change. We're going to move from a drive-through to a walk-in for both of those. And on May 17th, I believe it is, here at the drive-through vaccination center, folks can still come, but we'll ask you to walk in to receive your vaccination at the ambulatory surgery center here on the main campus where the drive-through testing is. And then a similar occurrence will happen up at Smith Northview, and then sometime later I think the community will be informed that we'll move all vaccination and all testing from this campus up to Smith Northview and just have one central location for you to get tested or be vaccinated. Now, I think vaccination can still occur here, and naturally folks can receive their vaccinations or testing through private physicians' offices, Department of Public Health, and other sites. So we feel like that meets the current demand. Now, should demand increase, we're going to have all of our resources ready to relaunch the drive-through and whatever we need, but we hope that's not the case. We hope we're on the backside of this thing, and hopefully these testing centers will serve our needs through the end of the pandemic. Erika, I think that the team has done a great job with this. Don't you think so?
I think they have done a remarkable job. 31,000 vaccinations, and I think over 80,000 tests have been performed since we started our testing center. So that is a large number. Just a great job from the team. So.
Absolutely. Last thing I'd share, Erika, is this week is National Nurses Week, and next week is National Hospital Week. We combine these 2 weeks into a 2-week celebration of all team members of our health system, and I encourage the viewing public to reach out, touch a nurse, tell them how much you appreciate them. All of our employees come together for one reason only, and that's to take care of the needs of this community. And now's the time to celebrate with them all the great work they do. It is remarkable people delivering extraordinary care with human kindness. That's our goal, and that's our wish for our community.
Thank you, Mr. Dean. And thank you to the viewing audience. Again, we encourage everyone to just stay up to date with all of our changes and all of the wonderful things we have happening here at the health system. It truly is amazing to see all the things that our team members are doing. And you can do that at sgmc.org, or you can like us on Facebook or follow us on Instagram. So thank you, and y'all all have a wonderful day.
Thank you, and happy Mother's Day.
Oh, thank you. Happy Mother's Day to everyone, all the moms out there.